Carbohydrates and diabetes. If you have diabetes, it is important to know about the different types of carbohydrates and understand how they affect blood sugar levels. The main function of carbohydrates is to provide the body with energy. They can be divided into three main groups: fast carbohydrates, slow carbohydrates, and dietary fiber. Fast carbohydrates occur naturally in milk, fruits, and white bread, for example. They can also be found in foods that have added sugar, like sweets and cakes. Fast carbohydrates are simple carbohydrates and consist of short chains of sugar molecules. They are rapidly broken down in the digestive system, and some can be absorbed directly through the intestinal wall into the bloodstream. When the sugar passes into the blood sugar levels rise. It can take a few minutes after eating fast carbohydrates for them to be absorbed into the bloodstream. When blood sugar rises, the body produces insulin. Insulin acts like a key that can unlock the cells so that sugar can get into the cells which need energy. If you have type 1 or type 2 diabetes, the body either stops producing insulin altogether, stops producing enough insulin, or stops being able to use the insulin that it produces. The result is that you can have high blood sugar for a long time, and that is unhealthy for the body. If you have diabetes, it is best to limit the amount of fast carbohydrates in your diet. Even if you don't have diabetes, it is better to have a diet with fewer fast carbohydrates. Slow carbohydrates are found in foods such as rye bread, grains, potatoes, root vegetables, rice, and wholemeal pasta. These are more complex carbohydrates and consist of long chains of sugar molecules. It takes a long time for the digestive system to break them down before they are absorbed into the bloodstream. This means you feel full for longer, and the blood sugar rises more slowly. This is good for your health because, with fewer sudden swings, it makes the blood sugar levels easier to control. However, it is important to know that cooking slow carbohydrates changes their structure, making them act more like fast carbohydrates by breaking down the chains of sugar molecules. This means that they cause the blood sugar to rise faster, and the more time used to cook the food, the bigger the change. For this reason, it is a good idea to eat boiled potatoes, for example, rather than potatoes that have been cooked in the oven for a long time. Finally, there is dietary fiber. They are found in foods such as coarse vegetables, rye bread, wholemeal bread, nuts, and in the skin of fruits. Like slow carbohydrates, dietary fiber consists of long chains of sugar molecules. However, dietary fiber is bound together in such a way that the digestive system cannot break them down. This means they cannot be absorbed into the blood. Therefore, blood sugar levels rise more slowly compared to both fast and slow carbohydrates. Food containing dietary fiber also contains slow and fast carbohydrates. Rye bread, for example, contains almost as many carbohydrates in total as white bread. You just absorb them more slowly. Therefore, dietary fiber makes the other things you eat more filling, so you feel full for longer. And it's also good for the digestion and helps lower cholesterol levels. In other words, eating dietary fiber is healthy and good for your blood sugar control. So, remember, fast carbohydrates are quickly absorbed and therefore cause blood sugar to rise quickly, but they don't really fill us up. Slow carbohydrates are absorbed more slowly and make us feel fuller for longer. Dietary fiber is not absorbed, but does fill us up and is good for digestion. If you have diabetes, it is recommended that you pay special attention to reducing the amount of fast carbohydrates in your diet and increasing the intake of slow carbohydrates and dietary fiber. Learn more about diabetes at Videncenter for Diabetes.dk. Thank you for watching.